Hey there, healthcare professionals. Today, we're diving into essential guidelines for managing drug-exposed newborns. These little ones can face significant challenges, especially if exposed to substances like opioids, benzodiazepines, or other illicit drugs during pregnancy. First up, let's talk about the process begins with a detailed history of maternal substance use. If needed, a urine drug screen, UDS, and meconium drug screen, MDS, are performed on both the mother and the newborn. If these tests are positive, or if the baby shows clinical symptoms like irritability, seizures, feeding difficulties, or vomiting, further assessments and social work consultations are initiated. Now, how are drug-exposed newborns treated after birth? Is the foundation. Babies are placed in quiet, dimly lit rooms to decrease stimuli and reduce withdrawal symptoms. Comfort measures like swaddling, gentle rocking, and skin-to-skin contact are crucial. Frequent small-volume feedings help prevent dehydration and support weight gain. Breastfeeding is encouraged unless ongoing maternal drug use is a concern. High-calorie formula, 22 to 24 kilocalories per ounce, may be provided if there are feeding difficulties. Comes into play when supportive care isn't enough. For opioid exposure, morphine or methadone is commonly used. Morphine typically starts at 0.1 milligrams per kilogram per dose every 3-4 hours, adjusted based on symptoms. Methadone can be started at 0.1 milligrams per kilogram every 6-12 hours and tapered slowly. Treatment duration usually lasts 5-7 days with gradual tapering over 2-4 weeks. Buprenorphine is another option, used in some centers at 15 mcg/kg/dose every 8 hours and is slowly tapered down. For benzodiazepine exposure, phenobarbital is often used. The starting dose is 15 to 20 milligrams per kilogram, followed by 3-5 mg/kg/day. Treatment duration depends on severity and can last several weeks. If the newborn is exposed to multiple drugs, a combination of treatments may be used. Phenobarbital is often combined with morphine or methadone for effective symptom management. Are crucial. Neonatal abstinence scoring systems like the Finnegan score track the severity of withdrawal symptoms and guide treatment adjustments. Babies are observed for irritability, feeding difficulties, and autonomic symptoms like sweating and fever. Continuous monitoring in the neonatal intensive care unit, NICU, may be necessary for severe cases. Let's not forget about polycythemia, common in these infants, can complicate NAS management. These newborns have an increased number of red blood cells, raising the risk of jaundice. Monitoring hematocrit levels and potential blood transfusions may be required for severe cases. Finally, managing is integral. A social worker will assess the home environment, check for previous Child Protective Services involvement, and connect families with needed resources. Social services may step in if there's a positive drug test, a history of drug use, or concerns about abuse or neglect. Supportive care is the first line of treatment, focusing on reducing stimuli and promoting comfort. Medications like morphine, methadone, or phenobarbital are used for severe withdrawal symptoms with tailored dosages. Babies are monitored closely with scoring systems to guide treatment adjustments. Social work involvement is essential for assessing environmental risks and ensuring safe care at home. By following these guidelines, healthcare teams can effectively manage drug-exposed newborns, reduce withdrawal symptoms, and provide the best chance for a healthy recovery. Thanks for watching.